Good evening, and thanks for joining us for this webinar about the HPV vaccine. My name is Tammy Sander. I do communications for the Hamilton County Health Department. I am joined tonight by a pair of experts who are going to tell us a little bit more about HPV, the kinds of cancers that it can cause, and what we can do to protect our children from them. Tonight's webinar is the 10th in a series of webinars that we've been doing, one each month this year, geared toward different children's health topics. We've hosted an array of topics, everything from internet safety to backpack safety, dental care to suicide prevention. And these webinars are really just part of a larger effort to reach out to parents, caregivers, educators, so they can make more informed decisions about the health and well-being of their kiddos. And at the end of this presentation, we do have two more webinars left for the year, one in November, one in December. We'll show you what we've got coming up, and if you're interested, how to get registered. But first, let me start by introducing tonight's panel. Julie Nagel has been a nurse for over 30 years. She joined the Hamilton County Health Department back in 2007 and now serves as the department's immunization coordinator and senior nurse. Julie has a passion for immunizations and loves teaching parents about the best practices and benefits of immunization. Sarah Vivo is the Adolescent Program Manager for the Indiana Immunization Coalition. That's a statewide nonprofit organization, as well as a co-lead of Unity Consortium's Mom Advisory Council. She holds a bachelor's degree in health services management and a graduate certificate in nonprofit management, both from Indiana University. Sarah's special interests include vaccine advocacy for teens and young adults, as well as vaccine education for non-traditional vaccinators. We were just talking about what that is, folks like pharmacists and dentists. Tonight, these ladies are going to talk about HPV. What is it? How is it spread? How do we protect our kids from this virus and the various forms of cancer that it can cause? I'm going to go ahead and jump right to it. I want to send it to Sarah first. And Sarah, let's just start by answering the most obvious question. What is HPV?
Thanks, Tammy, and thanks so much for having me. This is a topic that's near and dear to my heart. HPV is such a common virus in our society, and it's one that we can prevent cancer with a vaccine. So how amazing is that? So HPV stands for human papillomavirus. In the most simple terms, it's a virus, just like we know of other things like the common cold. It is transmitted through skin-to-skin contact, and there are lots of different types of HPV. In the vaccine that we have, we are able to prevent both cancers as well as genital warts. So HPV causes both genital warts and 6 different types of cancer that we know of. And like I said, the vaccine prevents all of those. And nearly everyone will get HPV at some point in their life, will come into contact with it. So studies have shown that 4 out of 5 adults will come into contact with HPV at some point in their lifetime. So that's to say that it's very common. So when we talk about diseases and we think about how frequently we're exposed to them or things like that, this is something that almost everyone is exposed to at some point in their life. So like I said, there are a ton of different types of HPV, more than 200 types. It's good to know that they don't all cause serious disease, but there are lots of different types out there, and you can also get it more than once. And the HPV that's the most dangerous is the kind that actually remains in your system and can crop up later to cause those additional problems. So 42 million people are currently infected with HPV in the United States. Most of those people don't even know it. No signs, no symptoms. 13 million people in the United States become newly infected every year. Again, they probably don't even know it. And 37,000 people get HPV-related cancers in the United States every year. And again, that's 6 different types of cancer.
So Julie, let's go to you. Let's talk about how HPV is spread and maybe what some of the symptoms are.
So HPV is spread through intimate skin-to-skin contact with someone that is infected with the virus. This can include vaginal, anal, or oral sex with someone who has the virus. And as Sarah has said, oftentimes people do not know they're infected. So, and there's no way of telling if they're infectious or not. So that's really important that we kind of keep that in mind and know that it's, not just vaginal or anal sex, it also includes oral sex. You cannot get HPV from blood or body fluids. You cannot get it from sitting on a toilet seat or hugging or holding hands with someone that has HPV. Swimming pools, hot tubs, cannot get it from there. You cannot get it from sharing foods or utensils. And you cannot get it because a person is unclean. So those are all kinds of things that, you don't have to worry about. But there is some good news. The good news is most HPV infections, 9 out of 10 actually, go away by themselves. Unfortunately, we don't know which one is not going to go away. So that's why it's real important that we are aware of all these different types of HPVs. Symptoms, we kind of touched on this already. Most do not cause symptoms, and it depends largely on which type of HPV is present. We will touch on that a little bit more here throughout the presentation, but very often we do not know if a person has HPV or not.
Yeah, so Sarah, if there's 200 different types of HPV, let's say, or more, are they all going to cause cancer?
Well, the good news is no, that's not the case. And so this is kind of a sciencey slide, but just to talk about that they can be transmitted in different ways depending on where the virus lives. So cutaneous is something that lives in the skin. And we know that those types of HPVs, there's 2 types that are included in the vaccine. Those 2 types are known to create warts. And so those are included with the cutaneous. And then the mucosal also, I'm sorry, I got ahead of myself there. Those are the kind that we just see on common warts. The mucosal ones are the ones that we're talking about with HPV, and they do cause the warts that we see in genital warts, which are kind of form in clusters around the genitals. And so this is just the different types of HPVs that live in our skin and in our mucosals. And so you might hear people talk about papillomaviruses in other situations outside of these that we're talking about that cause cancer. And that's because there are so many. But the ones that are the most dangerous are the ones that are included in the vaccine. So that's why the vaccine is so effective. So papillomas are just warts, that's what they are, and they occur in clusters in the genital area. They can be taken off through surgery or laser therapy. This is something that is the most visible form of HPV that we have. So, we talk about that most people don't have any symptoms. This might be the one exception. If you have genital warts, you're going to actually have some symptoms that you can identify with your eyes. The high-risk HPV types are the ones that are included in the vaccine. The problem with this vaccine is that it's not something that's going to prevent something that we see every day, right? So we think about chicken pox, or we think about a whooping cough, and we say we're going to vaccinate against these things, and then it's a very imaginable thing that your child could end up getting one of these sicknesses. But unfortunately, with HPV, we're preventing something that's probably, 20 years in the future from now. So you're getting exposed to that HPV. And if for some reason your immune system isn't able to clear it, it just stays in your body. And then over many, many years, it can develop into cancer. And we have no way of knowing who is going to develop that cancer. We have no way of making sure even that you've cleared it outside of PAP screenings. So that's why it's really important to get vaccinated, is to get ahead of the game and be able to avoid those cancers. So the 6 types of cancers that we know are caused by HPV, and I say it that way because there's some suspicion that we might find that they cause some other cancers as well. But for sure, we know that HPV causes these 6 types of cancer: cervical cancer, vaginal cancer, vulvar cancer, all in women, anal cancer, and mouth and throat cancer, excuse me, both in men and women, and then penile cancer in men. So cervical cancer is usually the one that everyone thinks of when they think of HPV. And even in the early days of the vaccine, there was a vaccine called Cervarix. That was one of the HPV vaccines that was very focused on cervical cancer. Like I said, now we know that HPV causes other cancers as well. But signs of cervical cancer are listed here. The most common is bleeding between your periods or after sexual intercourse. This is a common cancer in women, the 4th leading cause of cancer and cancer deaths. And like I mentioned before, it does take 15 to 20 years for cervical cancer to develop after that initial HPV infection. So this is something that you're likely not going to see the benefit from right away, but it definitely is going to be, that vaccine will be working down the road. And so one of the important things to note about cervical cancer is this is one of the only HPV-caused cancer that is routinely detected through screening. So when you go in and you get your Pap smear, that is looking for cervical cells that are precancerous. They can also do an HPV co-test. And so there is screening for this type of cancer, but not so much for the other ones. So as I mentioned, the FDA has 2 approved tests to find HPV in the cervix. So going to your gynecologist and getting a cervical cancer screening is really important, and it's recommended to start at 21 years of age. And then the guidelines vary depending on your risk and your age, but the American Cancer Society recommends that women 25 to 65 have an HPV test done every 5 years. And you might say, I didn't know I needed to ask my doctor to do that. And you probably don't. So I was speaking with these ladies the other day and said that I got something from my doctor that said that, both of my my cervical cancer test as well as my HPV test came back normal, and I didn't even know that they did an HPV test. And that's because they do something called co-testing a lot of times, which means you don't have to get a separate swab or anything done for it. They can go in and do it all at the same time and get both of those tests done.
Now, Sarah, a question here, because obviously now we're able to vaccinate children for HPV. Does that mean they will not have to have Pap smears and or HPV tests run later?
That's a great question. So we know that it's something like 98% of cervical cancers, 95 to 98% of cervical cancers are caused by HPV. So that's a lot, but it's not all. The other thing that we want to be thinking about is that if you have had an opportunity to be exposed to HPV prior to when you got vaccinated, that the vaccine can only protect you moving forward. So we really still recommend that all women are abiding to these guidelines, that they're getting screened. And beyond that, there are of course, other cancers that are not caused by HPV that can be detected through gynecological screenings and tests. So yes, you still need to get your screenings, even though it's a wonderful vaccine.
Mm-hmm. All right, Julie. So we're super fortunate that there is a screening for cervical cancer, but we're not so fortunate in that there really are no other standard screenings for the rest of the cancers.
Correct. So for vulvar cancer, it's much less common than cervical cancer. It's actually responsible for about 70% of vulvar cancers. But unfortunately, as you said, there is no testing. So that kind of makes things a little difficult. Now you can have some symptoms with vulvar cancer that include like itching, burning, or bleeding around the vulvar, color changes in the skin. So, and also like skin changes, you might see like either rash or wart. Kind of important to note the rash part because sometimes, that might not be something that you would think of as far as like a cancer would go. So those are all things that we unfortunately don't have screening tests for those. So it's kind of it's sad. We got to work on that.
Yeah.
Vaginal cancer, that one is the most cancers of the vagina are actually caused by HPV. Um, this one actually sometimes they can be found with the same screenings as cervical cancers. So very important, as Sarah stressed, that we get our screenings done. Now, as far as symptoms for vaginal cancer, you might have abnormal discharge, vaginal discharge, pain during intercourse. You could also have some abnormal vaginal bleeding. So those are all things that that we could look for as far as vaginal cancer goes. In past years, HPV has really been something that we talked about mostly in women, but as Sarah said, men can also get HPV. So they can develop penile cancer. HPV is responsible, I'm sorry, for about 60% of penile cancers. More common in men who have HIV or men who have sex with men. Again, unfortunately, there is no standard screening. Some symptoms that you might see: changes or problems in the skin around the penis, thickening of the skin, change of the color, flat growths that look maybe bluish or brown. So those are all things that men need to kind of keep an eye on as far as HPV related to penile cancer. Anal cancer, as we said earlier, can affect both women and men. Responsible for about 90% of these cancers. I thought that was a pretty significant number. Some more common in people who have HIV and men who have sex with men. This one, there is testing that is available, but it's not standard of care. So we're not getting this done. Like as women need to get their PAPs. Some symptoms would be bleeding from the anus or the rectum, lump near the anus, or itching or discharge from the anus or rectum area. This is a scary one. So mouth and throat cancer, HPV is responsible for about 70% of these cancers. We used to think more of tobacco use or alcohol abuse, but 70% of mouth and throat cancers are caused by HPV. More common, most common HPV related cancers in men, but like as we said, women also. There are no standard screening tests for this. However, dentists, routine dental exams, and doctors, when they do exams of the throat and neck, can detect some of this. Sores or lumps that symptoms include sores or lumps that don't heal, difficulty chewing or swallowing, just pain in and around the mouth. Oral route of HPV is the easiest to contract, and unfortunately, it's the hardest to clear if you're naive to HPV. Prevention. Prevention, abstaining from sex, probably number one, limiting the number of sexual partners, condoms for both men and women, and male circumcision. And then vaccines. Yay. This is like a rock star thing. Awesome that we have a vaccine that we can prevent cancer. So this is also good news. HPV vaccinations can prevent over 90% of cancers caused by HPV. This is a great stat that we just really need to be proud of in vaccines.
All right. So Sarah, walk us through what we need to know about this vaccine. When do our kids need to be thinking about getting it?
Yeah, so with all vaccines, we want to be thinking about getting vaccinated before we're exposed to whatever we're trying to avoid, right? So even with the flu vaccine, it takes about 2 weeks to kick in. So we recommend that people, get it early in the season so it has time to kick in. The same thing with the HPV vaccine. So we really want to get these kiddos vaccinated before they're exposed to the virus. And the earliest is age 9 that you can get the vaccine. It is a 2-dose series if you get vaccinated your first vaccine before the 15th birthday. So we really like to encourage between that 9 and 12 years old to get the vaccination series started. It can be given all the way up to age 26 across the board. So if you have a college student that skipped out on it earlier, we still want to go ahead and get them vaccinated. I think it's important to note that it's better to get it earlier for several reasons. First of all, again, the chance that you've been exposed already is really low. But also, our immune systems are so much more robust when we're young. So when we expose them to the antibodies that are in the HPV vaccine, you get a really strong immune response, and that's going to be protective for a much longer time as a stronger protection. So younger is better when it comes to the HPV vaccine. However, we'll take what we can get up to age 26. So if we need to do that catch up, we totally can. If you get your first vaccine at age 15 or after, it does become a 3-dose series. So that's another incentive to get your kiddos started early so that they only have to have 2 vaccines. And then beyond age 26, the vaccine is approved up until age 45. And so there's a note here that says the American Cancer Society does not recommend HPV for older than 26. And that is true. And I'll give a little bit of an explanation why. It's related to the things that I already mentioned. So when you are older, your immune system does not have as robust a response. And also the likelihood that you have been exposed is much higher. Again, 80% of people are walking around out there, have been exposed or are currently carrying the HPV virus and probably have no idea. So even if you've only had one sexual partner, there's a high likelihood that you could have already been exposed. So that's the reason that it's not recommended by the American Cancer Society. However, it is designated as shared decision-making for a vaccine in that age range, which is just a fancy way of saying that this vaccine might be good for some people in that age range, but you really need to talk to your provider about it. So the example that I like to give is if you married your high school sweetheart right out of high school, you both have only ever been with each other, you were not vaccinated, and then for some reason later in life, maybe you're 40 years old and you do not have a spouse anymore. Maybe they've passed away, maybe you've become divorced, and you're ready to re-enter the dating pool. There might be an advantage to getting the HPV vaccine for those folks. And I will say it's not going to hurt you. So the reason that it's not recommended is not because it's going to do any harm. I think that it's more that we want to make sure that we're representing that cancer prevention properly. That is, if you're getting it younger and before you're exposed, that you have much more protection than if you get it at that older age. All right. So this is just reiterating what I was already saying because I talk a lot. I'm sorry. So the recommended age right now is 11 to 12 years old. But like I said, it can start as early as 9. And I think that that 9-year-old recommendation is preferable to some people to get it done early, to get it done maybe have more time to complete the series. It's not needed. You only need 6 to 12 months to get that second vaccine in. But if it makes you feel better, then get it in at 9. That's totally fine. But definitely by that 11 to 12-year-old visit. And here in Indiana, we have what many people refer to as 6th grade shots, which is that 11 and 12-year-old age range where you're already going in to get your tetanus shot. You're already going in to get your meningococcal vaccine. Those are required for school. It's the same time that you need to be getting that HPV vaccine. So we can just kind of roll those all in together and get them done. And then, as I mentioned, 15 years and older, it is a 3-shot series. So you do have a vaccine 1 to 2 months later, and then the 3rd shot is 6 months later. So advantage to getting that first shot before age 15. So some concerns that we usually hear about the vaccine is that it has live DNA or virus or can make you actually get HPV from the vaccine. That's completely false. It is not a live vaccine. In fact, not very many of our vaccines anymore are live vaccines. So what it does is it sends just a portion or a dead portion of the virus in so that your body can recognize it and build antibodies to use in the future. And there's no treatment for HPV infection. So even though we can do detection for cervical precancers and cervical cancers, and we can visually see, other things, there's currently no treatment just for the infection. Unfortunately, we just see what that infection ends up causing. And so the vaccine does prevent 9 types of HPV. These are all the highest risk types. 2 of those are directly related to genital warts, and the rest of them are directly related to cancers. So you can know that you're getting a lot of protection from that single vaccine. There are a few people that the HPV vaccine is not for. Pregnant women, anyone with a severe allergy to yeast, and anyone who has had a serious reaction to an earlier dose of the vaccine. For pregnant women, I will mention that after you deliver your baby, even while you're still in the hospital, you can totally get the HPV vaccine then, and that's a great time for a lot of women to be thinking about that.
All right, Julie, let's talk about side effects. Is the HPV vaccine safe, and how do we know?
Yes. So with all vaccines, any medication, actually, side effects are possible. Most of the side effects that we see can actually be, I don't know if I want to say prevented, but we can help with those things. The first one being passing out. It's important that we eat before we get our vaccines and not after we've gotten our vaccines. Adolescents do so much better when they have some sugar, have some food on their stomach. So that's something important to kind of remember when you're going in for your vaccines, to eat before. Sometimes we might see redness or soreness at the injection site. You could use like a cool compress, no ice directly on the skin, but a cool compress. Um, if with that, along with low-grade fevers, you could use either acetaminophen or ibuprofen, but you wouldn't want to use aspirin for young children. Um, Fatigue, there's not much that we can do for that. But as far as headaches, we just making sure people stay hydrated after they get their vaccines. That's something that really, really helps people to kind of alleviate some of those other side effects. Yes, HPV is safe. We have had more than 15 years of monitoring and research. Um, More than 135 million doses have been distributed in the United States. And as Sarah was speaking, I was thinking about when HPV vaccine first came out, it was actually a 3-dose series for everyone. And with this monitoring and research, they've actually decreased the number of doses for persons less than 15 to 2 because they found that it was providing protection. So I think that's really neat that they're looking into these things on a daily basis. There is also a reporting system that is called, we refer to it as VAERS. It's Vaccine Adverse Event Reporting Systems. It's to do national early warnings of problems if there would be any with vaccines. The CDC and FDA look at these reports, and the reports can actually be submitted by patients, parents. Healthcare workers are required to report certain adverse events. So I just think it's a really neat system in place that parents, I mean, if you have a concern as a parent or a patient, you are able to report it. So I think that's really a great system that we have going on. This slide, I like this a lot. Don't let cost be a factor. Most insurances cover HPV first dollar. So it's paid for as long as it's given within the national guidelines. There are a couple programs actually available to people that are uninsured or underinsured. The first one is a federal program called Vaccine for Children, VFC program. The vaccine is free, provided to providers free. However, we do have to charge just a small administration fee sometimes, but HPV is included in this program. The other program that's available here in Indiana is our adult program. We call it the 317 program. That also is available for people that are uninsured or underinsured are eligible in the adult program. And Indiana actually has HPV in this program. Not all states do. Some states only have, a few. Indiana actually offers this. That just shows us how Indiana values our adults. Indiana also has a way for patients and parents to access their immunization records by validating a 6-digit authorization code sent either to their registered cell phone or email. And this is a way that parents and patients can get on, see what's given in the past, what's due for in the future. It's just a really great tool for parents. I've used it myself when my son was younger, and he's like, "Oh, I need my vaccine records tomorrow for camp." Oh, okay. So I was able to jump on here and get those. So it's a really great tool. So healthcare providers are required to enter immunizations for children into our statewide immunization registry. We refer to it as CHIRP. It's Children and Hoosiers Immunization Registry Program. Adults entry is optional, but most providers use EMRs, so they are putting those vaccines into the statewide immunization registry. Now, this is something that healthcare workers get in, and we're able to see then what people have had in the past and what they're due for in the future, not duplicating vaccines or giving children vaccines that they actually need. So Hamilton County gives immunizations to children on Tuesdays and Thursdays, and to adults on Mondays. We are having some specialty clinics for flu and COVID vaccines on Wednesdays. We also are expanding our hours on Thursday nights some, so that we can see more people after hours, after they get out of work, after kids get out of school. We are able to see people with and without insurance. So that's something to note. Make sure, if you don't have health insurance, if you have a health insurance, please reach out to us either by phone. Our phone number is 317-776-8500, or on our website. We have a lot of great information on our website as well.
And Julia, you can take walk-ins, but you really do prefer people go ahead and go to this link and register, right?
That is correct. We do have to run our insurance. So if we can get that done ahead of time, we can also review their immunization records before. Maybe occasionally we have to call doctor's offices or might have to get in contact with the school to get additional immunization records. So yes, we allow walk-ins, but pre-registrations are preferred. Sometimes when you walk in, unfortunately, we aren't able to see you if we can't get your insurance to go through.
I think now's a good time to stop for questions. If you have a question for either Julie or Sarah, please throw it in the chat box. We'll take a look at those and answer any questions you might have. In the meantime, we did want to share some additional resources where you can find information specifically about HPV as well as the HPV vaccine, namely, obviously, the Hamilton County Health Department as well as the Indiana Immunization Coalition. And Sarah, I'm going to let you go ahead and put a plug in here for the coalition. Tell us a little bit about the important work that you guys do over there.
Sure, yeah. So the Indiana Immunization Coalition just celebrated our 20-year anniversary last year. And for the large part of that time, we were focused on education and promotion around vaccines. But with the COVID pandemic, we actually began doing mobile vaccination clinics. So actually taking vaccines out into the community. So we have office hours on Monday at our location at 10th and Shadeland, but we also go out into the community almost every day. We're somewhere administering vaccines. So if you are looking for a clinic near you, you can go to our website there, vaccinateindiana.org, and check out our clinic calendar that has all of our open clinics. And all of our clinics are walk-in only. So you don't have to register or have any sort of an appointment. And we do see all ages as well. And we are VFC and 317 providers, as that Julie just talked about. So if you don't have insurance, we can help you out with that as well.
Well, we want to give you some time too to talk about this national conference that you've got coming up next year, because you single-handedly put this thing together. Tell us about it.
Thank you so much. Yeah, so I'm very passionate about the HPV vaccine and about preventing HPV. I think that I myself have known people that have struggled with fertility issues after having precancerous cells and things like that. And knowing that we now have a vaccine that could preserve fertility for our kids or our grandkids, it's just amazing. So I am very passionate about HPV, and I noted that we have an international HPV conference, but that we didn't have one just for the United States. And we didn't have one that was really just for people who are working directly with patients around HPV. And that's kind of the whole gamut, everything from vaccination and prevention all the way up to detection and treating cancers. So anyway, we decided that we needed to have a conference. So we are going to be having one here in Indianapolis in April. Really excited about it. We're going to be bringing people in from all over the country who are equally as passionate about HPV, so that we can all work together to really try to move the needle and protect more people so that we can stop HPV cancers.
That's fabulous. Kudos to you and your team. As promised, here are the last of the 2 webinars that we have coming up here in the coming months. In November, we're going to talk about vaping. Oftentimes, parents have no idea that their children are vaping. So we're going to give you some ideas and some thoughts on how to figure that out, and then how to really talk to your teens about it. We have partnered with Breathe Easy Hamilton County, as well as Noblesville Schools on this one. So we would welcome you to join us for that. And then we're going to be talking about lead testing in kiddos in December. If you want to register for any of these webinars, you just need to go to the Hamilton County Health Department's website, click on the Health Education tab, and then look for the Children's Webinar tab. And that will take you directly to a link that you can jump on and register for, just like you did this evening. Ladies, are you seeing any questions?
Yes, actually, there was one. Since it's been over 15 years since we started HPV vax, what statistics benefits have been documented? Sarah, I'm not real good with statistics. Are you aware of any?
Yeah, so that's a great question. And you're right on the mark in saying that, because we do look at vaccinating at that 11 to 12-year-old age range, we're just now starting to get the data. Like, these people are getting to the age now where we're seeing the dramatic decrease in cervical cancers. We're seeing the herd effect as well. So even people who are not vaccinated with HPV are benefiting from people getting the HPV vaccine, which is pretty cool. But we can look to other countries to see how their results have been, because we have other countries that have been vaccinating with HPV longer than the United States have. And places like Australia have seen like a 90% decrease in cervical cancers. And there was a recent report of a country, I can look it up here in a minute, I can't remember exactly which one, that is on track to completely eliminate cervical cancer by 2030 in their entire country, because they have such a strong HPV vaccination program. And I think that's what's giving us a lot of hope, a lot of juice, right, to get us excited about the HPV vaccine, because we know that it works. So yes, the data is coming, and we already have great results from other countries. And hopefully, as the years tick by, the United States will be able to show those same numbers. We're just starting to see the beginnings of them.
That is so promising and so hopeful. Great question. Any other questions, Julie?
So there was another. The question is, I personally choose to vaccinate my kids, but have heard some people say they weren't going to. What are people's main resistance, and what's your response to them? So a lot of people just don't like their children to get, 3 vaccines at a time, or they might not, they're afraid that their bodies are, they shouldn't be getting that much at one time. So some people like to spread things out, which we as healthcare providers at Hamilton County, we will talk to everyone about the risk and the benefits of vaccines. And we're very supportive of people if they want just one at a time. Like, you can get it today, and do you want to come back next week? Do you want to come back next month? We're very good about working with people that have some hesitancy. We like
Sarah?
to go ahead.
Yeah, go ahead. I was just going to also say, Sarah, have you heard of any reasons that people give for not wanting to or not choosing to get this particular vaccine for their kiddos?
Well, there's a lot of misinformation out there, which is unfortunate. And in this day of technology, misinformation spreads really quickly, and it's much harder to give the real information because many times it's much more complicated and less attractive than the misinformation. So, questions about like, will this affect their fertility? And the answer is yes, it'll positively affect their fertility, right? It'll prevent cervical cancer, and questions like that. So I think that there's a lot of misinformation. So it's important for people to know where they can get good information that they trust. And that looks different for different people. For some people, they really like the CDC. They really like the American Academy of Pediatrics. Those are great places. If you feel like you want to get away from those places and you want to go more local, your local health department, your local immunization coalition, has great information as well. There are lots of other minutia that come up, when talking about vaccines. People feel like bodies are getting overwhelmed with the number of antibodies and vaccines that they're taking in. But I promise you that when your 2-year-old goes and touches rocks and then licks their hands, they're getting exposed to many, many more antibodies than what we are giving them through vaccines. And to Julie's point, while we really will try to work with people who have concerns about reactions and things like that, the vaccine schedule has been put together with a lot of care, and especially for our much younger children, they take into account of their immunity that they inherit from their mother, and at what age that wanes and when we can start replacing that immunity. So there really is a lot of science behind it, which again makes it a little bit more difficult to explain everything. So my biggest recommendation is find someone you trust in the healthcare field and talk to them. Go talk to your pediatrician, go talk to your nurse practitioner, go talk to your local health department, have a conversation. We are more than willing to help you get to the bottom of whatever you're trying to figure out.
Julie, did you have any other thoughts on that particular question?
No, I love what Sarah just said. I'm going to have to use some of that. Thank you, Sarah.
Any other questions?
There was one more statement. I received an email this afternoon saying the vaping one was canceled. Will this be rescheduled?
That's really interesting. We had to, we made some changes to the speakers for that, but it is still on November 20th, 6 p.m. I apologize for any confusion that may have caused. So you might want to check to see that you're still registered. Just go back to the website and double check it. But yeah, I had somebody else mention that today, which I found odd because all we did was update the guest speakers and their bios. So no, it very much is definitely still on for November 20th at 6 o'clock. Thanks for asking.
And that's the last question that's in there, Tammy.
Well, fabulous. I do have Julie and Sarah's contact information up here. So if you think of any other questions after this is all over later this week, please feel free to reach out to them. They would be happy to answer any and all questions you might have about this vaccine and others. And we thank you all for joining us. Now, this has been recorded. So the question about maybe another parent who's not sure about whether or not to give their child the HPV vaccine, you might let them know about this webinar. We will share it on our social media accounts in the morning, the recording, and it will also live on our YouTube channel. So they can always come back and watch it at a later date or time. Ladies, I want to thank you for your expertise tonight. Thank everyone who joined us, and we wish you all a very wonderful night. Thank you.
Thank you.